Hi everyone, my name is Meg Frater. I'm a pharmacist and a member of the Pharmacy Practice Affairs team here at APHA. As we know, the COVID-19 pandemic is creating unprecedented challenges for the healthcare system that demand new flexibilities and authorities for healthcare professionals to respond. Throughout the pandemic, APHA has been tracking the most relevant flexibilities extended to pharmacists by the federal government to address the COVID-19 public health emergency. If you've tuned in to our weekly COVID-19 Open Forum webinars, you've heard these updates in real time. But during this video, I will provide a brief overview of the flexibilities and authorities you should be aware of to date. We'll talk about where they come from, what they mean, and how you can team up with APHA to help us maintain these practice advancements for pharmacists like yourself, who just want to be able to utilize their full expertise to care for patients now and in the future. So it was way back on January 27th that the Department of Health and Human Services first declared the COVID-19 public health emergency. And since then, the public health emergency was renewed twice. What a lot of pharmacists may not know is that when a public health emergency is declared or renewed, it remains in effect for up to 90 days. So it's important to note that many of the flexibilities and authorities pharmacists have received over the past few months to respond to the pandemic are actually tied to this public health emergency, meaning they'll expire when the emergency expires unless they're made permanent. Aside from federal and in some cases state government action, there are a few federal agencies that have the power to make some or all of these regulations permanent. These include the Department of Health and Human Services, the Centers for Medicare and Medicaid, and the Food and Drug Administration. So APHA has been working with a number of other pharmacy organizations to keep up the pressure on these agencies to ensure that pharmacists can continue to meet the challenges of COVID-19 and future public health emergencies. But we do need your help. We need to hear from members like you about what's working and what isn't. We need you to reach out to your representatives, and we need your engagement in our volunteer opportunities to really show that pharmacists can improve patient care. But before we dive into some of the flexibilities recently extended to pharmacists, I do just want to take a minute to address our major advocacy priority, which is provider status. You may know that many of the clinical services pharmacists provide to seniors nationwide should be billed to Medicare Part B. However, unless Congress passes legislation to amend the Social Security Act to include pharmacists as eligible providers, pharmacists will remain unable to directly bill for their services. Without this feasible and scalable mechanism for pharmacists to be reimbursed, limited access to critical patient care services will persist, and the country, including our schools, our businesses, and our economy, will not be able to fully reopen. So even if you've already used our grassroots advocacy tool shown here, you can go ahead and fill it out again and keep up the pressure on your representatives. I promise it only takes under a minute, and this is a way to take action now. We'll continue to make members aware of ways to take action in the future as opportunities arise. So now let's talk about some authorities and flexibilities extended to pharmacists, starting with Immunization Authority. HHS recently issued an amendment to the Public Readiness and Emergency Preparedness Act, or PrEP Act, to authorize pharmacists to order and administer vaccines to individuals ages 3 to 18 years old. This is a perfect example of an authority that's tied to the public health emergency, so advocacy is needed to ensure this flexibility is maintained. In fact, further action is still necessary to expand Pharmacist Immunization Authority to authorize pharmacists to immunize indicated populations at all ages. It's important that we keep advocating on the state level, particularly to remove state-specific barriers to administering immunizations, such as the often burdensome requirement necessity of a physician's order or prescription or other permissive authority required by the states. Like with immunizations, we also saw HHS issue guidance under the PrEP Act back in April that authorizes pharmacists to order and administer certain tests authorized by the FDA for COVID-19. This is another example of the federal government stepping in to improve access to pharmacist-provided care that we must maintain after the public health emergency ends. We know that testing will be key to reopening the country and keeping it opened. But right now, there are extremely limited payment pathways for pharmacists providing testing and all the related services involved, such as specimen collection and counseling services, and others I'll touch on in a minute. So APHA outlines some of these payment pathways in our pharmacy testing models for COVID-19 practice resource. So if you haven't taken a look, I highly recommend it. Of note, CMS did recently issue notice that the agency will reimburse eligible pharmacists for counseling patients about the importance of self-isolation while awaiting results of a COVID-19 test. but payment is contingent upon pharmacists working out an incident to relationship with a physician who must do the billing on the pharmacist's behalf. In addition, other services that pharmacists provide must still be addressed, such as patient assessment, ordering the test, specimen collection, interpreting the test, and reporting the results to the patient and appropriate entities. Without fair reimbursement, pharmacies may not be able to serve as COVID-19 testing sites. An area where we've seen many flexibilities is telehealth, which has quickly become a primary tool for providing care during this time. Flexibilities issued by HHS and CMS have meaningfully expanded access to telehealth services by allowing for the use of non-public facing software such as Skype and FaceTime, and relaxing location requirements to allow patients in all settings to receive telehealth services. In terms of payment, CMS issued a waiver which allows pharmacists to bill for some telehealth services provided under the incident to arrangements like I previously mentioned, and permits physician supervision to be provided virtually using real-time audio and visual technology. Most recently, CMS announced that Medicare-enrolled community pharmacies that are accredited programs and approved to bill Medicare Part B directly for diabetes self-management, or DSMT, services can now offer these services via telehealth for the duration of the public health emergency. APHA is actively working to maintain these flexibilities for pharmacists, but we do need to hear from our members on this subject and encourage you to reach out to our government affairs team about your telehealth needs. Early in the public health emergency, FDA took steps to allow pharmacists to compound medications in shortage for hospitalized patients without patient-specific prescriptions. This is an important authority to maintain to address current and future anticipated shortages. Many of our members have told us FDA's compounding flexibility is the only reason pharmacists have been able to keep up with patient demand. Lastly, I want to talk about how important it is for pharmacists to engage in state emergency response planning and coordination, including the request process and distribution plan for personal protective equipment, ancillary medical supplies, and the strategic national and state stockpiles. In order to have a comprehensive and coordinated effort, when an emergency situation arises, pharmacists' voices must be heard when it comes to respond on the national, state, and local levels. Your involvement in emergency response planning will help ensure that pharmacists have necessary operational flexibilities when emergencies arise, such as the ability to practice across state lines and to continue certain activities remotely, as well as prior authorization, refill, and home delivery flexibilities, to name a few. The idea of this video is to help pharmacists like you get into the advocacy game for your profession. On this webpage, we list out our key advocacy priorities and some talking points you can use in your own advocacy effort, so I highly encourage you to check it out. We have seen many policy wins for pharmacists and the patients we serve over the last few months, but we need to push hard to make sure these policies remain in place and continue to expand upon these advancements to achieve our policy priorities. Let's continue to help the public and our legislators understand how pharmacists can help lower healthcare costs and improve outcomes for our patients across the country.